Welcome everyone. In this video, I'll simplify the main types of epidemiological studies. Now, there are two main types of epidemiological studies. We have one, experimental studies or interventional studies. And the second one is observational studies or non-experimental studies. Now, when we say experimental studies or interventional studies, what does it mean? In experimental studies, these are studies where the investigators or the researchers try to test interventions. And usually in experimental studies, they manipulate people who are exposed to something in the studies. Okay, so for example, we want to test a new drug. We want to test a healthcare intervention or a healthcare program. Okay, so the researcher is going to create two different groups. One group will be exposed to the new drug or the new medication or the new intervention. Another group will not. Okay, so you see there is a manipulation over there. Such a study is an experimental study. So any study where the researchers are going to create two different groups and then try to manipulate who goes into group A, who goes into group B, so that at the end of the day, they measure whether the intervention or the drug or the program is effective or not. Such a study is an experimental study. So any kind of study where the researchers try to manipulate exposures, people who are exposed to something, either a drug, either an intervention, either a program, or even a vaccine, such a study is an experimental study. Now, we have the non-experimental study or observational study. Now, with a non-experimental study, the researcher is just going to observe. Okay, the researcher is just going to observe. They do not assign, they do not create any groups. They are not going to create a group that this group is group A, this group is group B. They just observe, either individuals or they just observe a population. Such a study is an observational or non-experimental studies. Now, under the experimental studies, we have two types of or two forms of experimental studies. We have what we call randomized control trial, or we can call it clinical trials. Then we have the non-randomized control trial, or you can call it quasi-experimental studies, or you can even call it field trial or community trials. Okay, so we have randomized control trial. Now, in randomized control trial, this is a form of experimental study where groups are created. One group is going to be in a control group. Another group is going to be in an intervention group. The intervention group or the exposed group is the group that is usually giving the medication or the intervention that they want to test. The control group is usually giving the standard treatment or the already existing treatment, or they are not giving anything at all. That is the control group. Okay, so in an experimental studies, we have the randomized control trial. In a randomized control trial, two groups are created. Now, what makes the randomized control trial unique is that now in the creation of the two groups, the population that was used to create the two groups, the members within that population, they were all given equal chances of being part of any of the groups, either the control group or the intervention group. Okay, so there is randomization. Now, why is there randomization? Chances were allowed so that the members in the population that were used to form the two groups, they were all given equal chances. Okay, such a study is what we call randomized control trial. Then we have the other type of experimental study that we call the non-randomized control trial or the quasi-experimental studies. Now, in the non-randomized control trial, the population that was used to form the groups, they were not given equal chances, okay, of being part or being featured in either the control or the intervention group. Okay, such a study is what we call the non-randomized. So there was no randomization. They were not given equal chances of being part of the control group or the experimental group. That's the difference. Now, usually, if you want to do an experimental study in among a larger population, you cannot allow randomization. So usually you do the non-randomized control trial, and that's the reason why we also call it the community trial or the failed trial. So for example, you want to test an intervention in a larger population, a big community. You can't do randomization. You get randomization is not possible. So in a situation where you want to do an experimental study, but then randomization is not feasible, such a study, you do the quasi-experimental or the non-randomized control trial. Okay, then we have the randomized control trial. So the randomized control trial, like for example, you are in a hospital ward, there is a new drug, you want to test the effectiveness of the drug. We will create two groups. Group A, they will be given the new drug. Group C, they would not be given the new drug. Maybe they will be allowed to take the existing medication, or they will not be given a new drug at all. Then now, we create the groups. Now, in creating the groups, all the patients on the ward will be given equal chance of being part of the control group or being part of the intervention group. Such a study is what we call randomized control trial. So randomization was employed. Okay, the members that were used to form the two groups, they were given equal chances of being part of either of the groups. Such a study is what we call randomized control trial. Okay, now in a situation where, for example, the same intervention, but you want to test it in, let's say, a very large community, like a whole region, okay, with a large population size, such a study, you can't do randomization. Okay, so in a study like that, they do what we call the non-randomized control trial. They wouldn't employ randomization. Groups are going to be created, all right, but they will not employ randomization. Okay, such a study is what we call non-randomized control trial or quasi-experimental study, or you can call it community trial, or you can call it failed trial. Okay, so these are the types of the first type of epidemiological study, experimental study. So in summary, experimental study is when the researchers or the epidemiologists or the investigators, they assign they assign exposures or they manipulate exposures. So usually they are going to create two different groups, whereby the two different groups, one group will be given the intervention, another group will be allowed to take the already existing intervention, or they will not be given any intervention at all. Okay, then so there is some kind of manipulation over there. Such a study is what we call experimental studies. Is that okay? Great. Now, under the experimental studies, informing the groups, there can be a situation where there can be randomization, where all the members that were used to form the group were given equal chances. And there can be a situation where members will not be given equal chances. In a situation where the members are given equal chances, such a study or such an experimental study is what we call the randomized control trial. And in a situation where the members that were used in forming the groups were not allowed equal chances, such a study is what we call the non-randomized control trial or the failed trial or the community trial. Now, experimental studies are very important in the sense that they are best when you want to establish cause to effect. Okay, so for example, you want to know the effect of a medication. Okay, you want to know the cause of something. Okay, usually experimental studies are the best. Okay, now another thing is that experimental studies can help minimize bias. The reason is because, for example, in the randomized control trial, okay, the randomization can help to reduce biases. Okay, and another thing is that it provides high quality evidence. Experimental studies provide high quality evidence as compared to other studies. The disadvantage with experimental studies is that it's very expensive and it takes a lot of time. Apart from that, there can be ethical issues. Okay, because for example, you are going to do an experiment. You are going to test a drug among people using human beings. Ethical issues are things that are going to be, may sometimes be a challenge, and you may have to go through so many processes to ensure that all these ethical, procedures and then ethical things are met before you start the study. Okay, now one thing about experimental studies is that it may not represent real world setting, because usually experimental studies may be done among a few people or a small group of people, okay, and may not represent the real world setting. Sometimes it may be done in a very controlled setting, and the setting may be different from the real world. Is that okay? So it may not represent the real world setting. Okay, so that is it for experimental studies. Then we have the second form of epidemiological study, that is observational studies. Now, in observational studies, the researcher or the investigator do not assign exposure. In an experimental study, the researcher assign exposure. The exposure can be a drug. So the researcher can assign a group A that will take the drug, group B that will not take the drug. So the researcher assigned exposures in experimental study. In non-experimental study or observational study, the difference is the researcher do not assign any exposure. No groups are created. The researcher do not create any groups. Is that okay? That is what we call observational study. Usually in observational study, the researcher just observe people in their real world environment or real world settings. Okay, that is observational study. So the researcher is just going to observe people in their natural setting, in their natural environment. So for example, someone is smoking. The researcher can decide to observe maybe group of people who are smoking for some time and see what will happen in the near future. Okay, such a study is what we call observational study. Now, under the observational study, we can have descriptive studies and then we can have analytical studies. Okay, what is a descriptive study? Descriptive study is when a researcher decides to just study someone. Okay, so we can decide to just study an individual. Okay, or we can just decide that, okay, for example, market women, then we decide that we are studying market women. Just market women, then we are studying them. Or we can say someone have developed a new condition, then we are just studying the person alone. We are just observing the person. Such a study is a descriptive study. Now, with analytical study, this is a study where we observe two different people. So let's say someone who is smoking, another person who is not smoking. We observe them so that at the end of the day, we look at what will happen. Okay, such a study, you see, we are making a comparison. So we take, let's say, two people who are smoking. Two people who are smoking in, let's say, 2025. We observe them till, let's say, 2026, December, and see what will happen to them. Two different smokers, and we are observing them. Now, once we are observing them with the mindset of making comparison to understand what will happen to them, such a study is an analytical study. Analytical study is a form of observational study where we study two people to make comparison. Okay, that's the difference. But with descriptive study, we just study someone. Or we may study two or more people, but the mindset is not to make comparison. Okay, if an epidemiologist is just observing people, but then the mindset is not to make comparison or compare them, they are doing descriptive studies. Now, the moment an epidemiologist will decide to study people and make comparison between them, epidemiologist can choose to study two different people with the same condition and then decide to make comparison, compare, okay, the two different people. Such a study, once you decide to make a comparison, you are doing an analytical study. Now, if you just decide to do mere observation, okay, to get to know that, for example, you take a particular population and you just want to study the population. Maybe you take a population of market women. You just want to study them. But you take a population of market women in market A, another population of market women in market B, and you want to compare. Once you decide to make comparison, it's an analytical study. Okay, so we have two forms of observational study. Descriptive, when you can decide to study a particular person. Your mindset is not to make a comparison. Let's say someone have developed a new disease, a strange disease, a rare disease. We've not seen it before. We now decide to study the person, describe, take history from the person, describe what is happening to the person as within a period of time. Just focus on that person and describe. Such a study is a descriptive study, but individual based. Then you can have a descriptive study population based. So for example, a new outbreak has happened in a population. We are just studying the population. Okay, we are not looking at population A and going to compare what is happening in population A to population B. Once we are not comparing, it's a descriptive study by population base. You can have a descriptive study individual base. Okay, the same way we can have analytical study population base, analytical study individual base. So for example, there is an outbreak of a disease in two different communities. We can take community A, community B, then we see the impact of the disease. We try and measure some rates of the disease in population A and then that of population B. Then we make comparison. Once we decide to make comparison, it's an analytical study but population based. Another example is, let's say patient A have developed a disease. Another patient B have developed the same disease. We can try and study patient A and study patient B. Maybe one is a male, one is a female. We can try to do a comparison. Okay, the disease in patient A, what are the signs that patient A manifested? What is the outcome? What is happening? Okay, how is the person recovering? Now, patient A is a male. Patient B is also a female. The same disease. How is the patient faring? How is the recovery like? What's the prognosis? What is happening? Okay, we try to make comparison, compare A and B. Once we decide to make a comparison between A and B, once you decide to make a comparison, it's an analytical study, but this time individual based. So you can have analytical study, population based, analytical study, individual based. Okay, so we have two main forms of epidemiological studies. The first one is experimental study, and then the second one is observational study or non-experimental study. Now, with the experimental study, you can also call it interventional study. Under the experimental study, now, first of all, what is experimental study? Experimental studies, the whole idea is that the researcher or the investigator manipulates exposures. So there is an exposure. Now, the exposure can be an intervention. It could be there is a drug or a vaccine or a program the epidemiologists want to test. So they will create two groups. One group will be exposed to the drug. Another group will not be exposed. Once there is any study like that, it's an experimental study. Once there is a study that you are going to manipulate or assign people who will be exposed to something, and another group that will not be exposed to anything, any study like that is an experimental study or an interventional study. Now, we have types of experimental or interventional study. We have randomized controlled trial, non-randomized controlled trial. Okay, or the randomized controlled trial, you can call it the clinical trial. Now, what makes it randomized controlled trial? Now, you know, in experimental study, the researcher creates groups. Now, we have a randomized controlled trial when during the creation of the groups, the population that was used to create the groups, the researcher or the investigator allowed equal chances. The researcher gave the members that were used to create the groups equal chances of being part of the control group and then the interventional group. Such a study where the participants, the members, the population, they were given equal chances of being part of either of the groups. Such a study is a randomized control trial. Now, in a study where it is not possible to employ or allow randomization, or in a study where randomization was not employed, such a study is what we call the non-randomized control trial. So the members that were used to form the groups, okay, they were not given equal chance of being part of either of the groups. Such a study is the non-randomized control trial. And usually such studies are very good if you are doing an interventional study in a larger community. That's why sometimes we call it the community trial or field trial. Okay, we call it the community trial or field trial. Is that okay? Great. Or you can also call it the quasi-experimental. Okay, so if you look at this very diagram, so the main types of epidemiological studies, we have non-experimental or observational studies, and we have experimental or interventional studies. Now, randomized control trial. So under the experimental intervention, we have randomized control trial. This is when, or we can call it the control trial or clinical trial. So this is when randomization was allowed. So understand that in experimental studies, the researcher or the investigator, they manipulate exposures. So groups are going to be created. One group will be given a certain intervention, another group will not. So there is an exposure. They manipulate an exposure so that one group is put into the exposed, another group is not exposed to the drug or the intervention or the program they are testing. Now, what brings about the difference between the two types of experimental study is randomization. And what is randomization? Randomization is when you are allowing equal chance. Okay, so for example, you want to create two groups. In randomized control trial, the groups that are created, the members that were used to create the group, they were given equal chances of being part of either of the groups. Such a study is a randomized control trial. Now we have the non-randomized control trial. In the non-randomized control trial, the members were not given equal chances of being part of the various groups. Is that okay? They select, not by chance. Okay, they use convenience to do the selection or the formation of the group. They use convenience. So for example, you want to test a drug in a larger community, in a big community, maybe a whole community, you want to do an experimental study. You can't do randomized control trial. You do community trial or you do a field trial. Is that okay? Great. So such a study is what we call the non-randomized control trial or quasi-experimental study. So for example, you see, look at this diagram. Did the researcher assign exposure? If the researcher assigned exposure, it means it's an experimental study. So if it is yes, that study is an experimental study. If it is no, then the researchers are just doing observation. So that is an observational study. Okay. Now, if it's an experimental study, information of the groups or doing the exposure, okay, when doing the exposure, is the allocation random? Was the allocation of the exposure, was it random? Okay, if yes, then it was a randomized control trial. If no, you use convenience, then it's a non-randomized control trial or a quasi-experimental or a community trial or a field trial. Is that then we have observational. With observational, the observational that you are doing, is there a comparison group? Okay, are you observing people, but are you going to make a comparison to another group? So you've taken someone you are studying. Are you going to compare the person to another one? If you are going to do a comparison, then it's an analytical study. If yes, there is a comparison, you are going to do comparison. It's an analytical study. If you are not going to do any comparison, then you are just going to do a descriptive studies. Okay, now the analytical study can further be divided into three. Now, are you going to compare two groups? Now, the comparison that you are going to do, the people you are going to compare, are you going to study them backward to make comparison? Or you are going to study them at a specific point in time, say few months, to make a comparison? Or you are going to study them ahead of time to make a comparison? If you are going to study back in time, but you aim at making a comparison, we call it case control study. Okay, if you are just going to make comparison, but then at a specific period of time, not backward, not forward, then you are doing a cross-sectional study. Some literatures will call it a prevalence study. Okay, or you want to study people and make comparison, but you are looking ahead of time into the future. We call that a follow-up study or a cohort study. Okay, or you can call it a prospective cohort study. Is that okay? Great. So we have two main or two broad types of epidemiological studies. We have the non-experimental study, and then we have the experimental or interventional study. Now, under the experimental interventional study, we have the randomized control trial or the clinical trial, and we have the non-randomized, or we have quasi-experimental or field trial or community trial. Now, under the experimental, remember that the experimental, we have two main forms of, under the observational, we have two main forms of observational: the descriptive observational studies and then the analytical observational studies. Now, under the descriptive, you can have descriptive where you are studying one person. You are just studying one person to just describe the person. Okay, you don't intend to compare. What makes it descriptive is that your mindset as an investigator is not to compare. Okay, and then we have the analytical. What makes it analytical is that you are studying, but you also have in mind that you make comparison, okay, between two groups. Is that okay? You can have an analytical study that is population based, and you can have a descriptive study that is also population based. The same way you can have an analytical study that is individual based, and you can have a descriptive study that is also individual based. Now, with the analytical, what makes it analytical is that your focus or your mindset is to draw comparison between either two individuals or two populations. Once you are doing any observational study, but your focus is to make comparison, it's an analytical study. Once you are doing any observational study, you are studying people in their natural environment. You don't aim at making any comparison. It's a descriptive study. You just want to observe them to see trends, to see characteristics, to see features, to see what is happening, to see causes. You are doing descriptive. But once you decide to study, for example, client A, client B, and your mindset is to compare, maybe one is male, one is female, they're having the same disease. Your mindset is to make comparison. Once you decide to make comparison, it's an analytical study. Now, in an analytical study, you can have population-based analytical study where you want to compare two different populations. We can have individual-based analytical study where you want to compare two different individuals. Okay, now with analytical studies, we can have three forms of analytical studies. We can have case control, where you study people backwards in time. So case control, we can also call it retrospective studies. Then we can have cross-sectional study, okay, whereby you study at the same time. You study both the exposure and the outcome at the same time. Okay, but in case control, you start with the outcome, then you look backwards to get exposures. Then we can have what we call the cohort study or the follow-up study. That one, you start from the exposure, then you study ahead of time to identify an outcome. Such a study is what we call the cohort study or the follow-up study. But then we can have a cohort study that is retrospective. That will be a subject for another day or a lesson for another day. Okay, so in summary, we have two main types of epidemiological study. We have non-experimental studies, and then we have experimental or interventional studies. Under the experimental or interventional studies, we have the randomized control trial, non-randomized control trial, or quasi-experimental study, or you can call it the community trial or the field trial. Under the non-experimental or observational studies, we have two forms. We have the descriptive and analytic. Okay, descriptive, meaning you just want to study a person or a population and just look at trends, patterns, causes, signs, characteristics, but your intention is not to make comparison. Analytic, you want to study an individual, okay, or a population, but your intention is to compare either the individual with another individual or population with another population. Okay, such a study is an observational, but then analytic, once you've decided to make a comparison. Now, the analytical studies can further be divided into three. We can have a cross-sectional, where you are studying. So with cross-sectional, you have one group that is exposed to something. It could be a risk factor, and another group that is not exposed. Okay, so a risk factor and an outcome. Then we are looking at them at the same time. We are looking at the exposure and the outcome in the group or the individual at the same time. Such a study is what we call cross-sectional study or prevalence study. Then we can have the case control study, whereby we start by identifying people who have a certain outcome. Then we study them backwards in time. That's why case control, we call it retrospective study. So we study those individuals backwards in time and see those who develop certain characteristics. Okay, and see certain exposures that we think are associated with the outcome, the present outcome. Now, we have another one that we call the cohort study or the follow-up study. Okay, now with the cohort or the follow-up study, what happens is that with the cohort study, or you can call it the prospective study, we look at people who are exposed to a certain risk factor, a certain determinant, a certain factors. Then we study them ahead of time into the future to see what outcome they are going to develop. Such a study is what we call the prospective cohort study or prospective studies. But then we can also have a prospective study a cohort study that is retrospective. That will be a subject for discussion on another day. Okay, so in summary, we have two main types of epidemiological studies. We have the observational or non-experimental studies, and then the experimental studies. Now, with the experimental studies, we have the randomized control trial and the non-randomized control trial, or the quasi, or the community trial, or the field trial. Now, experimental studies is very important because what does it do? It is best for establishing cause to effect. And, biases are minimized in experimental study because of the randomization, especially in the randomized control trial, which is the very common one that is done clinically. Okay, and then, experimental studies are very good for establishing cause to effect. And so it's of high quality evidence. It provides high quality evidence. But the disadvantage is that it's very expensive and time consuming. Okay, and there can be so many ethical, issues around experimental studies. Okay, and apart from that, the environment or the setting may be controlled and therefore may not represent the real world setting. Okay, in experimental studies, the environments are usually very controlled and you don't study the people in their natural environment. All that can affect the outcome or the results. Okay, but observational studies, you study people in their real world environment. Observational studies are usually less expensive and very simple and quick. Is that okay? But the point is that if you are comparing observational studies to experimental, observational usually cannot establish cause to effect. Is that okay? Good. And observational is also subject to bias, reporting bias. Okay, in observational studies. Remember that in observational studies, we have two subtypes of observational studies or subclassifications. Analytical studies, what makes it analytical is that you try to compare two different populations or two individuals. And then we can have a descriptive studies where you try to just describe. You try to just describe to get to know what is happening in an individual or in a population. But the mindset is not to what? Make a comparison. When you are doing that kind of observational studies, it's a descriptive study. So usually descriptive studies, we use it to just report on patterns of disease, whether a disease has occurred in someone, the causes, the trends. We use descriptive studies to just do that. You can have a single case. Let's say a new disease, one person is having it. We can use descriptive studies to study. Okay, in the case of, for example of a descriptive studies, individualized basis, case report. Okay, then we can have case series. So let's say a group of people, let's say 5 people with the same disease, then we study them and write a report, case series. That's what we call case series. Then we have the case report, a single person. Then we study the person, describe the nature or the characteristics of the disease in the person's natural environment. Such a study is the case report. But then group of cases, let's say 5 cases, 10 cases, then we study them, write a report. Such a study is a case series. Then we can have a larger population. That's why we mentioned earlier that we can have a descriptive study that is population based. What makes it descriptive study population based is that your mindset is not to compare the findings from that very population to another population. That makes it descriptive. Okay, so the same way you can have an analytical study that is also population based, and you can have an analytical study that is also individual based. What makes it an analytical study is when you decide to make a comparison, try to compare one individual to another, 2 groups of people to another group, or a particular population to another population. Okay, what brings about the differences between the two types of observational study is comparison, trying to make comparison. So the moment you want to study to make a comparison, okay, once you decide to do that, you are doing an analytical study. But if you just want to study to know patterns, to know trends, to know certain characteristics, either in a population, among an individual or groups, you just want to just study to know patterns, you don't want to make any comparison, then you are doing a descriptive epidemiological study. Okay, great. So this brings us to the end of the summary of the types of epidemiological studies. In our next lesson, I'll try and go further with the various types of analytical study, the case control or the retrospective study, the cross-sectional studies, and then the prospective studies or the cohort study. All the best.